Welcome to this explainer. Today we're exploring something, honestly, truly revolutionary happening right now in the state of Illinois. If you've ever felt like the healthcare system is just broken and no one is actually listening to the patients and the professionals on the ground, well, you are going to find this absolutely fascinating. We're unpacking the Illinois Care Initiative. This is a brand new, grassroots framework proposed by Healthcare for Illinois. See, instead of politicians just handing down some massive, pre-written bill from on high, this initiative is completely flipping the script. It is based entirely on a radical, listen-first approach to state healthcare reform. And I am incredibly excited to walk you through exactly how they plan to pull this off.
Okay, let's dive into this roadmap. We're going to cover 1. The healthcare frustration, 2. The Listen First initiative, 3. The community opinion survey, 4. Learning from past failures, 5. Models worth studying, and finally, 6. An Illinois-built solution.
So, starting off with Section 1, the healthcare frustration, understanding the current condition.
Look, before anyone can propose some grand, sweeping solution, we have to establish an honest, statewide assessment of what is actually broken, right? And in Illinois, the problems are extensive. We're looking at a web of interconnected issues that are quite literally suffocating the system. You've got skyrocketing costs and medical debt that are just crushing everyday working families. We see severe administrative complexity and prior authorization red tape that's burning out our doctors and nurses. Then, there are massive questions surrounding Medicaid administration and the state's reliance on private managed care organizations. Add in hospital instability, really dangerous rural healthcare shortages, and those exorbitant prescription drug costs. It's a lot. You really start to see how a problem in one area, like administrative burden, causes physician burnout, which then leads to shortages, which ultimately limits access to care. It is all totally connected.
Moving on to Section 2, the Listen First initiative, flipping the script. So here's the reality. Illinois families simply cannot afford to wait indefinitely for federal relief, like Medicare for all. They need relief right now, and that is exactly why Healthcare for Illinois was founded. What makes the Illinois Care Initiative completely unique is that it starts with questions instead of predetermined answers. It recognizes that healthcare expertise doesn't just live in corporate lobbying offices, right? It lives with the patients, the caregivers, and the small business owners all across the state. This framework doesn't represent some finished 1,000-page piece of legislation. It actually represents a living, breathing process.
Now, what's really interesting about this slide is the sheer contrast in how legislation is normally built. I mean, the old way is solutions first. Politicians, lobbyists, special interests, they draft a massive bill behind closed doors, introduce it, and only then do they ask for public comment. And usually, it's way too late to make any meaningful changes. But the Illinois Care Way completely reverses this. It's a totally bottom-up, listen-first paradigm. The public, the healthcare workers, local communities, they actually provide the blueprint via statewide forums before a single word of legislation is even drafted. It's a total game changer.
Which brings us to Section 3, the Community Opinion Survey. Your voice matters.
So how do they actually gather this massive amount of public input? Well, the initiative uses a really detailed statewide community opinion survey. This is basically the practical engine driving their whole focus on listening. For example, let's look at question 4. It actively asks residents, which approach do you think is best for designing Illinois healthcare reforms? Government-led, designed primarily by elected officials, or collaborative, developed jointly by the public, healthcare professionals, policy experts, and legislators? Think about how empowering this is. They are actively asking the public if they want a seat at the table to identify local challenges.
And they're taking this commitment to transparency to an absolutely unprecedented scale. Check this out. Step 1. They aim to hold public health care forums in all 102 counties in Illinois. Not just Chicago, not just the wealthy suburbs, but every single rural county. Step 2. They want to live stream and archive every single meeting of a proposed healthcare reform commission so absolutely anyone can watch it. And Step 3. Every proposed reform must be published online for public comment before it even reaches the General Assembly. It's basically a complete dismantling of the traditional backroom deal.
Okay, moving to Section 4, learning from past failures, the implementation transition. Because let's be real, you don't build a new house without looking at existing designs to see what causes a roof to cave in, right? Enthusiasm just isn't enough. We have to know what to avoid. Across the country, states have tried to push massive, single-payer systems and just hit brick walls. Vermont's Green Mountain Care was highly celebrated, but ultimately it stalled out because the financial burden on the state's economy was deemed unsustainable. California's CalCare repeatedly stalled over financing and complex federal approvals. Even Illinois' own previous attempt, Senate Bill 2873, hasn't advanced because of massive hurdles with federal laws like ERISA and the harsh practical realities of actually transitioning the system. They all shared a really great vision, but they lacked a realistic way to cross the bridge.
And this brilliantly illustrates what it all comes down to: the implementation transition. The source material defines this as the realistic financial, legal, and operational path required to move from your current system to your new one. Basically, you can map out a beautiful destination all you want, but if you don't have a realistic, step-by-step path to actually get there, the reform will fail every single time.
Let's look at Section 5, Models Worth Studying, Building the Blueprint. So this is where we shift from looking at failures to objectively analyzing the success stories. How have other states achieved pragmatic, targeted improvements that actually survived the transition process? Well, two models really stand out here. First is Connecticut. For years, they relied on private managed care organizations to run Medicaid, but in 2012, they replaced them with administrative services organizations. The state reclaimed the financial risk and policy control, while private companies just handled the administrative paperwork. It proved that Medicaid administration and insurance risk do not have to be tied together. Then there's Maryland. To stabilize their hospitals, they moved to an all-payer system using global hospital budgets. So instead of rewarding hospitals for just high volumes of care, they stabilized their budget so the hospitals could actually focus on patient outcomes and overall efficiency.
Let's move to and see how this builds directly into the core philosophy of the Illinois Care Initiative. The quote goes, "Successful engineers rarely invent every component from scratch." I mean, it's a perfect metaphor, right? If Illinois wants to fix its system, it absolutely doesn't need to reinvent the wheel. It needs to benchmark these successful, proven state models, like Connecticut's Medicaid setup or Maryland's hospital stability, and creatively adapt them to local needs.
Which brings us to Section 6, an Illinois-built solution, the final blueprint.
This is where the whole concept really comes together. By synthesizing that massive public survey data from all 102 counties with the objective, data-driven lessons learned from benchmarking other states, Illinois can construct a localized blueprint that actually works. As the source document states, healthcare reform should not simply happen to the people of Illinois. It should be built with them. It perfectly captures the mission. By avoiding the trap of top-down models handed over by think tanks, and instead combining expert analysis with real grassroots listening, the state can create a uniquely tailored, sustainable healthcare system.
So, I want to leave you with this final, provocative thought pulled directly from question 15 of the Community Opinion Survey. If your healthcare story could become part of the official record reviewed by the governor and a healthcare reform commission, would you share it? This initiative isn't just an abstract policy paper. It is an active invitation for you to participate in the process. It's empowering, it's totally different from business as usual, and it just might be the blueprint for the future. Thank you so much for joining me for this explainer, and keep exploring.